How you doing? Dr. Ulysses Jackson. Welcome to Mental Health Mondays. All right? Mental Health Mondays, man. Dr. Ulysses Jackson. Thank y'all for tuning in and trying to get acclimated with what's going on here. I'm trying to do something totally different than the regular that y'all see around here. And I appreciate you coming on my YouTube channel and following me. You know, it's been overwhelming. So what Mental Health Mondays is going to be about? Well, I looked at some things that I was doing and I realized that between my Instagram, my Facebook, my TikTok, I'm getting about 4,000 or 5,000 people every few days. So, which lets me know I have something relevant to talk about. You know, so I appreciate everybody that's been following me. Hit that like button and subscribe. With the things that's happening around, you know, say in America, in the country, and even the world, I think it's relevant that we have these type of forums and conversations. But one thing that I'm big on is that the professionalism. And I know that I come from a place where I don't know it all. You know, I definitely don't know it all. That's not my forte. That's not what I do, and that's not what I'm here to do. Because the smartest person in the room usually gets to learn nothing. So I never want to go in a room where I'm the smartest person in the room. So Mental Health Monday, we're gonna have some guests, you know, that's gonna meet me somewhere. I'm gonna go to some studios. So people are gonna meet me because they're already inquiring about having these questions and these conversations. Also, what we're gonna do is we're gonna have situations where you guys can interact. Call, ask me anything y'all wanna know, man. You know, especially when it comes to the professionalism and the profession of mental health and mental health counseling. Some things that we're gonna touch on is like this gun violence. These topics I try to stay away because there's so many experts and other people involved with the reason for it and gun laws and regardless of what side of the fence you stand on, this is the issue that we have to address. And I'm going to say this, which everyone says when it comes to mental health. Talk to someone. Because when I get a predetermined idea in my mind, I'm going to do this to this person. Or I got this gun on me and I'm walking around with him. I wish he would. Or I wish he would. That energy that I'm portraying, it's going to lead to something. You know, so how did I get from point A to point B with this energy of I'm walking around with a gun and I have the attitude of I wish somebody would. So this is where we have to have time to have these conversations with each other about, hey, are you all right? You know, and I'm real big on don't stop and ask somebody, are you okay, if you ain't really ready to listen. So these are the type of things we're going to talk about. We have the sexual violence that's been happening. The date rape, acquaintance rape, you know, family type of situation. This carries on. You know what I'm saying? It's a lot of stuff happening in places where we're trying to suffer in silence. You know, men and women that's been abused. You know, we're not opening the forum and turning this into a clinical discussion. There's information. But if you happen to be a victim of a sex violence or perpetrator of that, these are the times where you have the forum where you can come together for people, man, where you don't got to be embarrassed or ashamed about anything that's happened to you. You know, we're talking about re-entry. For those that have been incarcerated for long periods of time and they come home and they're trying to acclimate back into society. And they come, I'm good. You're not good. 10, 15 years of hearing on the child, on the count, on the noise, on the mail. You know, come on. You know, and we hear about the sexual predators that's in jail. Everybody in there wasn't a gorilla and a killer. Someone was the victim. These lead to mental health conversations. These lead to men and women getting honest at times. I saw a podcast the other day where an anonymous person wrote a letter about his experience. He's not the only one. So we got gun violence, you know, and then even with the immigration going on. Where do you stand with that? You know, some people like welcome people in. Other people like, man, we got enough people. What side of the aisle do you stand on? What side of the fence how does this affect you on a daily basis? What do you really feel about immigration? Then we got racism. You know, how do you feel about racism? What do you do when you see an interracial couple? You know, how do you really feel? And then you get to your family reunion, you see your best cousin, and he's in an interracial relationship. How does that affect people? Or you say something derogatory about racism to find out your partner, your coworker, is in an interracial relationship. Now you put your foot in your mouth. These are the things that lead to certain events, leads to certain situations, and these are the conversations that we have. The motivation, if you get it, you get it. You know what I'm saying? The inspiration, if you get, there's forums and there's people that specialize in that. And there's some people that do talk radio that's just gonna grab any conversation, anything that's going on, and talk about it for hours. You know, that's not what I'm trying to do. I'm trying to get to some situations that's relevant to us that we deal with on a regular basis. And that I encounter on a regular basis. And to clear the air again too, my name is Dr. Ulysses Jackson. I'm a licensed mental health counselor in the state of New York and I own my own private practice. I'm comfortable right now. Years ago, I wasn't. Today, I am. So when I'm doing this, I'm trying to share information and get some things going around, stirring up the beehive, getting some things moving and shaking. So when you go out, you can say, I heard that today, or I thought about that. There's some family reunions going on right now that people don't even want to go to. Some things that's happening that's really going on. So for a lot of people that tuned into that video about who is Ulysses Jackson, who is Dr. Jackson, I appreciate that. You know, that really went on to give you an insight of what I've done. And I spent years and days and months to get these credentials. It wasn't easy, it wasn't hard. So again, I believe that I have something to say. You know, I'm not a rapper that could put some words together. So check this out, how I look at this. What words can I put together? I know the DSM-5. I know my own experience. I have regular interaction with clients every day. Without breaking anybody's anonymity, I got to put this together in a way where I'm giving it to you, and it's not in the clinical session. That's why anything you want to know, ask. Leave it in the comment section. Y'all tuning in, y'all hitting the button, y'all watching me for a few minutes, get the most out of it. How I look at it is like this. Imagine going to your favorite restaurant. You're with your family and your friends. They eat all of the food. You don't eat. And then the bill comes and you pay for it. That's how relevant our time is. What are you getting out of it? Yeah, I surfed the net. I go see some funny stuff on TikTok, Instagram, you know what I'm saying? But sometimes I say, what's the takeaway? And one thing I do is I watch and see, what is everybody doing? What can I do different? I cannot turn this into a clinical session where 10,000 people's on and I'm counseling an auditorium. I can't do that. But what I can do is pick up some relevant topics that you guys see every day, that you guys experience: domestic violence, anger management, assault, abuse, poverty, stress, anxiety, depression. I could go into stuff like that and we could have a discussion about that, you know? And with that PhD, which makes me a doctor, they consider me an expert in this field. So I could sit home and do telehealth. I could go to one of these hospitals and be a mental health counselor and sit in the back and get the most out of it and leave it at that. Or I could share some information with you guys. So all questions, nothing's irrelevant. All questions are relevant. You know, the Q&A, all that stuff is welcome. So again, as we get ready to set up this platform for Mental Health Monday, I want to have some topics and discuss some things that you want to hear. I don't want to discuss things that I just want to hear. I want to discuss some things that you want to hear. The weather's getting nice. I'm hearing about people going on vacation, and if you don't make X amount of dollars, you can't go on vacation. Come on, that leads to anger, that leads to anxiety, that leads to stress. You know what I'm saying? So these are some relevant topics that we want to talk about, you know what I'm saying, to get some points across. Again, I can't even thank you guys enough for taking the time out to hear what I got to say, you know, and find out more about me. Another thing, I started doing these videos around February, and I'm big on consistency because I'm also a substance abuse counselor, and I come from an area where if you do something for 90 days straight, you're going to change the behavior. So that's what I try to do. I try to get up for the 90 days straight, or almost every day, and do a video. 60 minutes, 3 minutes, 4 minutes, and just go. So if you look at my YouTube channel and you go down, you're gonna see short videos, 2 and 3 minutes, of topics, because I was fishing. I was putting it out there. I was seeing who would listen and who wouldn't listen, you know? And then when I put up the last 2 videos and I seen one go 2,000 in a matter of a couple of hours, I was like, okay, I must have something that some people want to hear. So I said, now I gotta not poison y'all. So what's relevant to you, you know? And some questions and answers that y'all may ask and give may help the next person and their journey. You know, because I really don't call this recovery a lot. I call this discovery. Because if I got anxiety and I'm dealing with social anxiety, or I'm dealing with depression or persistent depression, and I see somebody else say, this is how I do it. I'm talking about that depression where you can't get out the bed. I'm talking about that social anxiety where you in the crowd and you don't even want to talk. I'm talking about that anxiety that you're driving and you stop and have a panic attack. How do you get through that? Do you run and get medications? I'm talking about when somebody says, you're acting weird, you're a little bipolar. I'm talking about, do you take your medical insurance, get on the back and call your provider and get the best help you can get? Because it's out there. Talking about isolation. I'm talking about thinking that you got this all by yourself. These are areas that we got to talk about. You know, you ain't got to be a social butterfly, but then that sitting home by yourself all the time, that's no good. That's not going to go nowhere, man. So, again, I plan on sitting down with some people and having real conversation, but it got to make sense. You know what I'm saying? It got to make sense. And I'm here for y'all, you know, and I believe that the information that I've acquired over the years, it needs to be shared. It's relevant. You know, we're at the end of the month of May, which is, they call it what, Mental Health Month. I'm creating this, like I said, I'm creating a weekly talk, you know, conversation discussion called Mental Health Mondays, where whatever you want to talk about. I have Barbershop, Champ Lanes in Bayshore, where my partner owns. You know, Barbershop Talk is good. That's a place where people go. But again, as I launch that, it got to be something real relevant. You know what I'm saying? So shout out to Champ Lanes Barbershop. And then also some people I worked with in the music industry that's been reaching back out to me and telling me, yo, I see you. Do your thing. You know what I'm saying? Shout out to them, you know what I'm saying? And even in my local neighborhood, man, some people that see me and say, yo, Doc, I see what you're doing. Try to keep that going, you know? Because to me, the total self-centeredness is, where I come from, I got mine, you get yours. And I'm trying to do things different today. So for every answer I try to give somebody, I'm not looking for another problem. We try to look to be solution focused, even in our conversations. I feel good about what I'm doing. I feel good about where we're going. I feel good about, you know, the summer coming up. And I'm just here, man. And I'm enjoying the ride. And I want to see where the ride takes me, man. So it's Dr. Ulysses Jackson, man. Start to tune in on the Mental Health Mondays.